A pattern of angry or irritable mood, argumentative or defiant behavior, or vindictiveness lasting at least 6 months, as evidenced by at least 4 symptoms from any of the categories and exhibited during interaction with at least one individual who is not a sibling. Aggression, defiant, argumentative, loss of temper, angry or resentful, blames others for faults, deliberately annoys others, vindictive or spiteful, or problems paying attention. In an article written by Katie Kai and Argyris Stringaris, it states, disruptive behavior problems are also associated with increased costs to society. It is estimated that the costs arising for individuals with antisocial behaviors in childhood are at least 10 times higher than in non-antisocial individuals by the time they reach 28 years. And this is on page 2 in their article, and that information came by Scott, Knapp, and Henderson from 2001 in their article Financial Cost of Social Inclusion Follow-up Study of Antisocial Children in Adulthood, and it was a British medical journal. In Katie Kai and Argyris Stringaris' article Oppositional Defiant Disorder, it states, ODD has consistently been found to predict later depression and anxiety, and it was found that childhood oppositional defiant disorder predicted young adult depression, and anxiety disorders were often preceded by adolescent ODD. In the article Oppositional Defiant Disorder, Gender Differences and Co-occurring Symptoms of Mental Health Problems in a General Population of Children by Linda Monkfold, Lundervold, and Menger, it was a follow-up study for the Bergen Child Study, and 7,007 parents had given consent for their child to be looked at on the ODD scale. Out of those 7,007 children, 6,150 had no missing items on the ODD scale in the parent and teacher reports. In the article by Monkfold, Lundervold, and Menger, there was a significant occurrence in both boys and girls, but boys have a tendency to have more ODD symptoms. 73% of the boys were rated high on the hyperactivity scale, and only 34.1% of girls were rated high on the hyperactivity scale for ODD. There is no one-size-fits-all treatment for children and adolescents with ODD. The most effective treatment plans are tailored to the needs and behavioral symptoms of each child. Treatment decisions are typically based on a number of different things, including the age of the child, severity of the behaviors, and whether the child has a coexisting mental condition. Psychotherapeutic is a popular evidence-based treatment for behavior therapy. The one used for ODD children is called parent-child interaction therapy. The parent and child work together through a set of exercises while a therapist coaches parents through an earbud. Parents learn to increase positive interactions with the child and to set consistent consequences for undesirable behavior. Children learn to rein in behavior and enjoy a more supportive relationship with parents. Pharmacological are the medicines that are given to ODD children for treatment. Medicines are not specifically indicated for ODD. However, as many children with ODD have co-occurring conditions such as ADHD, they may be on medication for those other disorders. In addition, some children are so troubled by their own aggression and their difficulties managing their painfully low frustration tolerance that a clinician may recommend medication for treatment. Cognitive problem-solving training. This is a type of therapy that is aimed at helping your child identify and change thought patterns that lead to behavior problems. Social skills training is when your child also might benefit from therapy that will help him or her learn how to interact more positively and effectively with their own peers. One teaching strategy is to allow the student a cool-down break. This normally is a corner of the room or an area where the student feels comfortable. Normally, students who need to use the cool-down area are angry or upset. Be sure to make the cool-down breaks available to all students in the classroom to avoid singling out only those children with anger control issues. Whenever a student becomes upset and defiant, offer to talk the situation over with the student once they have calmed down, and then direct the student to the cool-down area. Another teaching strategy is to have a behavior plan or use positive reinforcement. Have the student participate in creating a behavior plan for themselves. Students can feel a greater sense of ownership when they are invited to contribute to their behavior management plan. Students also tend to know better than anyone else what triggers will set off their problem behaviors and what strategies they find most effective in calming themselves and avoiding conflicts or other behavioral problems. The last teaching strategy that I'm going to talk about is do not get entangled in arguments. The careful teacher avoids being dragged into arguments or unnecessary discussion when disciplining students. When you must deliver a command to confront or discipline a student who is defiant or confrontational, be careful not to get hooked into a discussion or argument with that student. If you find yourself being drawn into an exchange with the student, like raising your voice, reprimanding the student, immediately use strategies to disengage yourself by moving away from the student, repeating your request in a business-like tone of voice, imposing a predetermined consequence for their noncompliance.